afternoon and welcome to our presentation on nursing philosophy and rationale. This is a collaboration between Christy Whitfield and Diana Hollingshead Parker, both RNs. Today we are examining our philosophies and what has caused us to form them. Each of us have had a combination of education, research, and experience itself to form our philosophies. This is from Christy Whitfield. My nursing philosophy is that all patients should come first. They are the reason that I became a nurse in the first place, to help people. Nursing is a complex field, sometimes described as an art, while others describe it as a science. Those in the field approach their patients and coworkers with varied backgrounds that become foundation for their beliefs and priorities in their nursing care. Some pull from technical backgrounds and aim for being proficient in every skill that may impact the patient. Others offer caring hearts and open ears so that the patient will not be lost in the labyrinth of lab results and test tubes that all too often become the primary focus for care. Her experience: I always knew that I wanted to be a nurse from the time I was little. I became a CNA as soon as I graduated high school. While I worked as a CNA for 6 years and in the ER, I became an LPN in 2004 and worked in the ER for a while. I then decided it was time to go into long-term nursing and was at the same nursing home for 11 years. I decided to go back to school in 2012 to become an RN. I knew that this is what I wanted to be, and my children were getting older, so I figured it was time. I graduated in 2015 as a registered nurse. Diana Hollingshead Parker. I have been blessed to have had many varied experiences as a result of making nursing my career. I started as an 18-year-old nursing assistant. There were no CNAs then. Entered into the U.S. Army for nurses training and moved on to mobile intensive care nurse, ER nursing, infectious disease certified, nursing supervisor, diabetes nurse educator, and I'm now a school nurse. In all of these roles, I have been drawn to the most autonomous and have been required to continue my education for each one, improving my nursing care each time. My nursing philosophy has evolved from doing a good job to providing equal, quality, non-judgmental, compassionate care for all my patients. Nursing is not just a job, but a mission, and the missionary has to be trained and willing to accept new knowledge to improve their care of others. Our tools to forming our philosophies. Quality improvement is a continuous process involving all levels of the organization working together and further across departmental times for producing better services for healthcare clients. Quality assurance is relying on introspection in each problem and correcting individual performance. In the old days when I first came into nursing, there was no such thing as an incident report. If something went wrong, you did your best to cover it up and hope nobody would find out. Now there's a quality assurance guideline for each action, and people want to be preventative, so they are now filling out forms with ideas of how the healthcare could be not only prevented but improved. Quality improvement is a continuing process that utilizes proactive and reactive strategies. The processes go beyond meeting pre-established goals or catching up to the competition. Rather, it involves exceeding expectations and creating a new opportunity. And these new opportunities are what give nurses new opportunities as well. As we move forward, we're able to increase our knowledge, increase our autonomy, and I think that all these things help increase the patient care. Patient-centered care. Patient-centered care is defined as nursing being the protection, prevention, and optimization of health and abilities, and prevention of illness and injuries, alleviation of suffering through diagnosis and treatment of human response, and advocacy in the care of individuals, families, and communities. Excuse me, sorry. Think about this for a second. Treating the illness is important, but what if you could help that patient not be ill in the first place? What a great service that you're doing to them. What a great service you're doing for their children. As a school nurse, I often have to discuss with people why immunizations are important. So that gives me another role of being the advocate for those people that need the care. We believe that it is true that we nurses need to work not just to help the sick, but to educate about disease prevention, patient self-care, and be an advocate for our patient. Interdisciplinary team. Interdisciplinary team is a group of healthcare professionals from diverse fields who work in a coordinated fashion towards a commitment for the patient. To do this, a nurse has to be and has an obligation to the community and to communicate and work well with all members of the best interests. The days when we all had our own little line in the sand and we didn't cross it and we didn't collaborate need to be gone. Those are the ritual things that people talk about. We need to be collaborative in our approach and collaborative in how we care for people. A nurse advocate must be able to meet a client on their level of understanding. I said this in another presentation, but Albert Einstein says, if you can't explain it to somebody with a 5th grade education, you don't know it yourself. So it does the patient no good if you cannot explain it so they can understand it. The patient's best interest must be at heart. This includes promoting, protection, and supporting the client's decision, even if it's not something that you agree with. Evidence-based practice. Evidence-based practice is defined as an integration of the best evidence available, nursing expertise, and the values and preferences of the individual families and communities who are selected. The evidence-based practice de-emphasizes clinical decision-making based on a custom or ritual. Again, there's that ritual. Integrates the best available research with other sources of data, including the clinical expert of the patient. On Facebook, there was an article on the sixth sense for nurses. So part of taking all that data is being able to look at that patient and say, you know, I know the data says this, but I'm not thinking that patient looks well. The evidence-based practice relies on rigorous integration of research evidence on the topic through integrative reviews, which are rigorous systematic inquiries with many similarities to original primary studies. It typically involves weighing various types of evidence, and often an evidence hierarchy is established. So when you look at the study, you can't just say, oh wow, medicine X is better than medicine Z. You have to look at who's paying for the study, what's the sample size, what are the criteria of the study, and then you can weigh and place in the hierarchy where the information that most benefits you. Informatics is defined as a specialty that integrates nursing science with all the available information and analytical data, knowledge, and wisdom in the nursing practice. Technology is very useful in improving safety and quality of health plan. Nursing informatics is the integration of this technology and the nursing expertise to assimilate and evaluate data. It deals with the use of technologies in order to organize and provide healthcare the best possible useful way. Computerized systems allow quicker and more accurate charting and recording, providing more quality patient care. When I first started working in the ICU, 3 times a shift, you ran a little strip, you measured it, you wrote it down, you hope you got the data for the physician and for the patient. Now they have monitors that do all that for you. Every arrhythmia, everything is cataloged, and you can simply run a report, put it in the chart, and analyze the patient's reaction to what's going on at the time. It's a vast improvement for us. These systems save time and improve the quality of information to further link the patient's safety. Nursing information contains a large number of tools which range from the very neat computer to the extremely difficult system. The new medical records charting system are called electronic medical records, or EMRs. As Medicare and the federal government require medical records, we are forced to stay ahead and to be current in our techniques. So again, we're forming our philosophy by the quality improvement, the patient-centered care, interdisciplinary care, evidence-based practice, and informatics. Our references are Finnerman and Kenner, Kenny and Nunnery, and the experience that we both obtained by being nurses. Thank you so much for listening.